Assalamualaikum warahmatullahi wabarakatuh. Good morning. Thanks for the chance. I would like first of all to introduce myself. My name is Clorampenicol. I'm from Pharmacy Department, Health Polytechnic of Gorontalo, Indonesia. And I'm presenter of this paper with the title Oral Suspension Availability Formulation Clorampenicol. My team are Siti Nurhalisa Akuba, Mrs. Priskais Wichita, and Mrs. Julfi Ayu. Well, I will explain the background of this research. Clorampenicol can be formulated in oral suspension. Clorampenicol can be formulated in oral suspension because chloramphenicol is difficult to dissolve in water. The solubility is 1/400. Chloramphenicol is used as an antibiotic. Chloramphenicol is an antibiotic. Chloramphenicol can inhibit bacterial growth. This drug works by inhibiting bacterial protein synthesis by binding the submit 5', and bacterial ribosome. Compare the concentration of HPMC as a binding agent in chloramphenicol oral suspension. In this study, the HPMC or hydroxyl methylcellulose concentration is differentiated with the aim of saying the concentration of how many HPMC can be formulated in oral preparation, namely suspension. Oral suspension preparation can mask the bitter taste of chloramphenicol. Chloramphenicol has a bitter taste, so it is made in oral suspension, which contains additives such as sweetening agent, namely sucrose. Oral suspension preparation are more widely used in society. Suspension are widely used because they are easy to use in children, infants, and also for adults who have difficulty swallowing tablet or capsule. Methods. Wet granulation. Wet granulation was carried out by adding a binder, which was used in this study by HPMC. This method is compatible with active substances that are resistant to moisture and heat. Result. Granule moisture, the result. Wet granulation method is to wet the tablet mass with a certain binder solution until it gets a certain level of wetness. Then the wet mass is granulated. When granulation is selected, when the active ingredients is resistant to water or solvent and heat. Granules are formed by binding the powder with a binder. For example, a binder in the form of a solution or a suspension and a binder in a dry form. From the result of the treat granule moisture test, the formula below is not more than 3%. Granule flow properties. Granule flow properties are greatly affect the uniformity of tablet weight. So it is necessary to test the flow properties in order to current the tablet. The resultant has a uniform weight. Granule flow properties can be known by measuring the flow time and angle of repose. Flow time is the time required to flow a certain amount of starch of the equipment used. The dispersion time test. The redispersion test was carried out to determine the ability of the suspension to obtain homogeneously redispersed by the light Shaking redispersion is influenced by the viscosity of the preparation, where the higher the viscosity, the redispersibility, the resulting lower. The dispersion is also affected by the particle format in a suspension. Sedimentation volume test. The sedimentation test was carried out to determine the preparation ratio that occurs during suspension storage for a certain time. Organoleptic test. Organoleptic test is a test using the human sense as the main tool for measuring the acceptance for the product. General applications includes color, presence or absence of smell, taste, and clarity. pH test. Clorampenicol is one of the most chemically known antibiotics, stable in all applications and has excellent stability at room temperatures and a pH range of 2 to 7. The maximum stability is achieved at a pH of 6. At the temperatures of 25 degrees Celsius, it is known that the pH of the three suspension formulated meets the pH test requirement. Specific gravity test. Specific gravity test on suspension preparation is to calculate the value viscosity of the preparation because specific gravity is one the factor affect viscosity. Viscosity test. The viscosity test is carried out to find out how much consistency the preparation is indicated. The thickness of a preparation to high viscosity is not accepted because it can cause problems with pouring the suspension from the container and the difficulty of preparation to be dispersed again. More volume test. Volume test transferred as an oral solution and suspension placed in a container with the volume stated on the label not more than 250 milliliters, which are available in liquid from or a liquid preparation reconstituted from a solid form with the addition of a certain chorus with a specific volume and removed from the original container will give the volume of preparation as indicated of the label. From the result of the third test, the average volume test formula is 100% according to the volume listed on the label 60 milliliters. Hypothesis. Based on research, Clorampenicol suspension with different concentration of HPMC using 1%, 2%, and 4%, formula 3 is the best formula. Future works and or limitation. The continuation of this research is evaluation tests such as drugs contents test, dissolution test in chloramphenicol suspension. That's all from me. Wassalamualaikum warahmatullahi wabarakatuh.